Right. Okay, well, let's start. We have already some people. So my name is Sandra Mignon. I work with Plan International as a CAAFAG advisor. I'm also the co-lead of the CAAFAG task force. And today, I welcome you to this clinic on needs assessment, focusing on child recruitment. And so I was supposed to have a co-facilitator who unfortunately, I think had some connection issues. So we'll see if he can join us later. This was Musa Gombo from Nigeria. But yeah, we'll see. If he managed to join, then I will have a co-facilitator. Otherwise, Pedro is here from the Alliance today as well to help me facilitate. So thank you, Pedro. So maybe before I start, just to give a bit of background on the format of these clinics. The clinic is a bit different compared to a webinar. So we've done quite a lot of webinars for those of you who have followed us now for some time. And the format of a clinic is less formal than a webinar. So with webinars, we have panelists who share their knowledge, their experience. Whereas with a clinic, the idea is really for you, participants, to ask questions, to share your experience and your knowledge as well. So it's meant to be more like peer learning. So I'm here to facilitate. I have content also to share. But the idea is really for you to participate. So that's why you have the possibility to unmute and ask questions. So I have a few questions for you. So don't hesitate, raise your hand, open your mic, and then you can share your ideas. So that said, now I think we can start. So I will start with a quick overview of the Program Development Toolkit. Maybe some of you are already familiar with this resource. This is one of the big resources that we have done at the CAAFAG task force. And this is a toolkit. This is basically a guide to walk you through the steps on how to design a program for CAAFAG. So as you can see, it's organized around the 5 steps of the project cycle. So the first one, Module 1, is focusing on background information, so like the form of child recruitment, the risk factors, protective factors, and also the legal framework under that first module. The second module is focusing on context analysis, and this is where we basically document the situation. So this is the module that we will focus on today, where you will have lots of resources, tools related to context analysis and needs assessment as well. Then the third module is the program design and strategic planning. This is a module that really guides you on how to design a log frame. There you can find also a bank of indicators to select from to design your project. You have outcomes. Basically, it's like a ready-made tool to really help you design your log frame. And then module 4, you have more guidance on the implementation. So here you have things on the staff recruitment, on data management for case management, for example. And then you have the learning and evaluation, the last module. So today we will really focus on the second module, which is the context analysis. So with the context analysis, maybe it's worth explaining what is the difference between a context analysis and a needs assessment. So it's the context analysis is basically wider. So for context analysis, you will document the risk, for example, of implementing a program on CAAFAG. You will look at the consultation with former CAAFAG. You will do a gender analysis, a stakeholder analysis, and a needs assessment. So basically, a needs assessment is one element of a context analysis. So today we're going to focus more on needs assessment. But if we have time, I will also show you the resources that are available to do a wider context analysis that will really help you to understand the environment, the dynamics, the who influence child recruitment, for example, at the community level. You have like a lot more information. And yes, so now I will quickly show you how to access this information. Pedro, if you can drop in the chat the link to the toolbox, the toolkit, so that people who don't know the toolkit can access it. And I will show you briefly how this tool is organized. And so here you can see the document. So I encourage you to download the latest version of Acrobat to open the document as a PDF. And here you will see on the right side for me a paperclip icon. If you click here, you will see all the tools that I'm going to talk about today, plus a lot more that are embedded into the document, right? So it's a PDF that has inside all the resources, all the tools. So for example, if we look at needs assessment here you have the FGD, so the focus group discussion with adults. You have also the focus group discussion with children. You have household surveys. You have also key informant interviews with adults. So if we click here, let's say, click OK. And now you have, I guess you can see comprehensive needs assessment. You have all the information about how to use the tool. An example of a script to ask for informed consent that you can adapt. And then you have all the questions, right? So it's a Word document that you can easily adapt. You can make all the edits that you need, so it's adapted to your context, right? So it's all open source and easily accessible. So right, I just wanted to show you that so that you know how to access the information, and then later on you have time to dig and look for the resources. So now let's go back to here it is. Okay, and I have a first question for you. I'd like to know who has already done a needs assessment or maybe even a context analysis on child recruitment, and sorry, there is a typo, who has used some of the tools of the toolkit? No one? Okay, all right, well, that's fine.
Hi, Sandra. Can you hear me okay?
Yes, I can hear you.
It's Jan Brouwer here in from Vancouver. And to answer your question, yes, in a limited way, I've had a chance to do some wider context analysis, but also drilling down to some of the needs assessment more specific to a very specific region.
Great. Can you tell us in which country it was?
In a couple of different contexts. South Sudan, both in the north of South Sudan and the south of South Sudan, responding to different caseloads where their recruitment contexts were different. And also in Syria, in northeast Syria and northwest Syria. Over.
Great. Thank you. Thank you very much. And have you used some of the tools of the toolkit, or was it your own tools?
No, definitely use some of the tools of the toolkit. In fact, I printed out the PDF. It was rather extensive because it's a huge document, right?
Yes, I know.
And when conferring with the CAAFAG task force that was set up in northeast Syria, as well as the whole of Syria, wider partners, as well as some other colleagues and other organizations, would very much refer where we could at all times try to go back to such a reliable source of guidance. Over.
Okay. Great, Good to know. Thank you. Thank you,
Welcome.
Ian. Anyone else who has done a needs assessment focusing on CAAFAG? No, that's okay. It was just to know maybe if I could rely on you to share your experience. So Ian, maybe I will come back to you later if you'd like to share your experience from South Sudan and Northeast Syria.
It sounds good. All good. Thank you.
Great. So I will now just give you a very quick overview of how this module is structured in the guidelines. I will not spend too much time on it, but just to give you a snapshot so that you know how to look for the information. So the context analysis process is divided in 3 phases. You have the planning phase, I would say the getting ready, and then the actual implementation. The context analysis, let's say the objective of the context analysis, which is wider than the needs assessment, is to understand really the current situation of child recruitment and use, understand the dynamics of identification, release, how do children leave the armed group, how can we identify them, what are the different strategies, and also the reintegration. So what are the challenges that some children may face when they reintegrate into their families and communities. So now we're going to look at the first phase of planning. I think that's really all what we have time for today. That phase is divided in different steps. So first we look at the research questions and the scope. Then the methodology selection. So there are a number of methodologies that are available in the toolkit. You don't need to use all of them, but based on the research question, you will see which methodologies are useful. And then you have information about the timeline, the human resources, the budget. So we're just going to focus on the research question for today. And so before you look at the research question, the first question you need to ask yourself is, what is the information that you already know, right? So there are quite a lot of information available already. It may not be public, right? Because we know it can be sensitive. So it's worth asking colleagues, other NGOs, if they have already some resources, some data that you can use so that you don't need to, ask again the same information. In some countries, you have also the MRM, so the monitoring and reporting mechanism. If you have good connection with UNICEF and the MRM people, you may have access also to some of this information. So like the way children exit armed groups, for example, usually they know. So it's worth asking the type of activities that children play, this kind of thing. Usually they have information. Then you need to also ask yourself if CAAFAG is a sensitive protection concern in your context, and if you can expose children, people, or your own staff to any harm. And usually we know quite well, but there are contexts where this is extremely sensitive and where we need to be extra cautious in the way we collect data, to make sure we're not exposing anyone to harm, if even your own organization is not exposed to any harm. And then you can consider also if you want information about prevention, the release and identification, and or reintegration. This is how the questions are structured. So let's say if you know that in your context you can only do prevention, maybe you will focus your needs assessment only on the questions that are related to prevention. Same if your area of intervention is exclusively in reintegration, maybe you will also direct the question. So I will show you in the toolkit the research questions, and I will walk you through them briefly. Because that's really how the whole toolkit is structured. Once you have your research question, then you will find all the links. Okay, so here are the research questions. So here you can see that they are organized around program risk. So the first three questions are around the risk for organizations to implement a CAAFAG project, the risk for the children. Can you expose them to retaliation, risk of arrest, detention, rejection, discrimination from the community, and any mitigation measures that you can put in place so that you reduce those risks. So that's the three first questions. Then you have questions about prevention. So what are the armed groups recruiting? So usually that question, we can leave it aside. It's sometimes too sensitive to even ask that question. And it's not that important, actually. Then you have questions about the processes of recruitment. So you understand really how children are recruited. Are there any intermediaries? Are there people who are putting pressure on the children, on the family, so that they are recruited? Are they kidnapped? Are there any coercion, threats for them to be recruited? Then what are the risk and protective factors? The question 6 is really important if you want to do prevention programs. So you need to understand what are the risk factors that increase the likelihood of child recruitment, and on the other side, the protective factors. If you want to design effective prevention programs, your program needs to address these risk and protective factors. And the last one is, are there any existing community-based mechanism, practices? Maybe the families have already set up some system to prevent the recruitment of their children. So it's good to understand those practices so that you can leverage them, build on them in your program. For the release, here you have 3 questions. The first one is on the roles and responsibilities, because we know this may have an impact on the release, depending on the level of responsibilities, the status that some children may have in the armed group. We know this may have an impact on their exit and the way, they can leave the armed group. Question 9 is on the way children actually exit the armed group. So do they run away? Are there any formal demobilization process? Are there negotiations that sometimes parents organize with the armed group, with some maybe local authorities as intermediaries? Are there already mechanisms that the communities has put in place to negotiate the release of their children? In terms of reintegration, so the question 11 is about the risk, the challenges faced by boys and girls, how the humanitarian community can support this reintegration in all the different levels. Question 13 is very interesting to me. It's the criteria of a successful reintegration for children and what we need to achieve it. And this criteria is basically defined by the children themselves. So this is really the participation of children who will say, well, for us to be successfully reintegrated means X, Y, and Z. And this criteria can be very different from one country to another, from between boys and girls as well. So it's important to ask the question separately to boys and separately to girls, so that you understand what it means to be, what are those signs, like what are these attributes that says, yes, I feel reintegrated in my community when, X, Y, and Z. And this can help you to design your reintegration program, but also to measure it. Because the reunification of a child, the registration of a child in at school, for example, doesn't necessarily mean that the child is successfully reintegrated. It's just one step of it. So to meaningfully measure reintegration, this question of criteria of successful reintegration is important and coming from the children. And the last 3 questions, so 14 to 16, There are questions more related to the gender analysis, where we look at access and control of resources, the safety concerns, the social and cultural norms, and how these will have an impact on the prevention and the reintegration of children. So, for example, can children safely take public transportation, for example? If it's not the case, how can we mitigate the risk? Can girls manage resources? If you distribute cash, for example, to girls, do they know, not that do they know, but like, can we expose them maybe to pressure, harassment from family members who want to have access to that money? So it's understanding all these dynamics before you design your program. All right, I'm going to stop here for the questions, the research questions. So just to explain, so these are not the questions we're going to ask directly to the people, right? These are research global questions that then you're going to respond to through different tools and different questions. Any questions so far on the research questions and the different tools?
Hi, Sandra, I have a question.
Yes.
But maybe more of a comment. Also, as part of the wider assessment, is maybe picking up on some of the coordination structures that exist on the humanitarian, on the child protection side, education side, even health side, and how available those members may be to try to support eventual services, I guess, in the context of reintegration. I'll stop there. Over.
Sorry, can you say that again? I'm not sure I
So
understood.
in the wider needs assessment, or in the wider, I guess, context analysis of the assessment, is the perhaps need to identify the different humanitarian coordination structures that are existing that may be amenable to participating in prevention and response to CAAFAG, for example. And I guess my question is about, maybe it's buried in these questions, all these great points of questions around program risk, prevention, release, reintegration. I guess I'm asking is, maybe involving them in some of this process, or having an intercoordination of focal points coming together, or at least participating in some of the local CAAFAG task force mechanism to come up with or participate in some of the context analysis and get their buy-in from the beginning, rather than just drop it on their lap at the end and say, hey, we need you to do this. I'll stop there. It's more of a comment than a question.
Yeah,
Over.
no, but that's a good point indeed. It's true that in the toolkit, we mentioned them more in terms of the strategies to do prevention and reintegration, how to do it like a multi-sectoral approach, how to engage other sectors. But it's true that it's more like at a later stage, and it would be great to engage them right from the beginning. So yeah, good point. Any other comments or questions? I see there's quite a lot in the chat.
Hi, Sandra. If I may, this is Abigail from War Child Holland.
Yes.
War Child Alliance. Apologies. So just two quick comments. One is in the chat about under prevention section to ask about armed groups and armed forces. For me, I was just wondering whether that would not actually change something that is generally supposed to be less risky to do work on prevention, to something that is actually quite risky when you start asking that question. And then maybe a question that I was hoping to also see in prevention is something about the socialization of boys and girls, and how boys and the value that a particular community or particular setting has for boys and girls and what they contribute. Again, that also helps us to start to consider some activities, for example, based on what one would be doing in terms of prevention. Anyway, just a few thoughts. Thank you. But thank you. Just to say the toolkit is fantastic. We have not used it particularly in terms of CAAFAG. and I think that is the objective now. But definitely, in terms of generally doing context analysis, I think there are some similarities, but I really appreciate this particular focus on CAAFAG. Over.
Thank you. Thank you, Abigail. So yes, to answer your first question, this question about who are the armed groups and armed forces recruiting, as I said, this one is actually almost maybe not a good idea to ask unless this is really low sensitivity environment and there's no problem. But this one really, yeah, feel free to drop it. And actually, even all of these questions, the idea is that you select the questions that are useful for you, that are relevant, that are, not too sensitive. So you have the right to pick and choose, really. It's nothing is compulsory here. Regarding the social reintegration of children, it is embedded here. So the challenges, the risk here is quite often the issues that they face is a social reintegration. So actually there are lots of tools, including tools to collect data with CAAFAG. It's actually, you have two tools. One is a workshop that you do with former CAAFAG. So there are a number of criteria to organize this. I don't have time to detail everything here, but basically you can organize this kind of workshop, and then like that you will collect a lot of information about the issues that they face, the solution that they identify themselves. So like, what do they need to address these issues, and so on, related to the social reintegration. So yes, absolutely, it's here. It's just embedded into that first question, which is a little broad. Right, I see also some questions. So from Sandra, hi Sandra, Shaheen was saying that in Lebanon, the context is very sensitive. So this is why it would be great to know how this vulnerability can be assessed in a safe, appropriately sensitive manner without explicitly stating the purpose of the research and label it under CAAFAG. Yes. So we're actually going to talk about this. And I'm interested to hear from you, what are the strategies that you can put in place? Right, I see. Well, the other question. So there is a question in French from Seka. So the risk is not so much related to prevention, but in the fact that looking at people and processes in a volatile environment. Simple activity of prevention can be a dangerous research subject if it's highlighted by individual or dynamics that are sensitive. Yes. Yes, indeed. And we're gonna exactly talk about that now. So let's move straight to that question. So what are the barriers to do a context analysis or a needs assessment on CAAFAG? What are the risks, what are the challenges that you have faced? And maybe at the same time, the follow-up question is, what are the risk mitigation measures that you have put in place to reduce the risk? Who would like to start? Jan, would you like to share your experience from South Sudan and Northeast Syria?
Okay, thanks very much. Maybe I'll try not to ramble a bit. So to maybe address some of the barriers. Well, for example, in South Sudan, the context for the most part was such that there was formal disarmament, demobilization, and reintegration taking place. So that was, I hate to use the word enabling, but it was a factor that allowed humanitarian actors and political actors to engage with armed forces and the state forces, as well as to some extent the opposition groups as well. There was a framework there. There was a DDR commission that also allowed us a lot of entry points to come in. The the barriers were insofar as trying to get further cooperation to access the populations before they were released, for example, and also being able to scale out humanitarian actors that we knew were going to be needed for service provision. All right, so there's others, but that's a quick snapshot of my short experience with South Sudan in 2018 and 2019. On the Northeast Syria side, it was the opposite. There was no formal DDR commission or formal process, other than the fact that one of the several armed groups that were recruiting in both Northwest and Northeast Syria, well, they were listed by the UN Security Council and they as recruiting. And they had an action plan where they were required to release children. But the biggest barrier was their lack of cooperation around it. You know, they largely were still trying to deny that we were recruiting children. And so for us to really work with them to try and be able to more coherently arrange assessments or understandings or service provision, that was really uphill. And that's one side of it. And then a second barrier was, like I used the word before, buy-in from some of the humanitarian partners, where we wanted their involvement. This is the CAAFAG task force wanting their involvement in these early stages of trying to develop understandings and program that would be needed. And they weren't getting paid to do it at this point in time, right? And you know, we advocated for all sorts of different reasons, and we gradually got some further cooperation to try and join in on this process of trying to establish systems, or even understand what systems were needed to try and really try to address both prevention and response. So I'll stop there. I'm sure other colleagues have some other barriers as well. Go ahead.
Thank you.
Yeah, can I come in for Lebanon?
Yes, please.
Yeah, so we are facing several risks on different levels. So from a political and security side, so Lebanon, as you may know, hosts multiple powerful non-state armed groups. So any inquiry into child association may be interpreted as political interference or kind of security monitoring. And the staff may be seen as, investigating armed groups. And also the families may fear consequences if they admit that a child is recruited. And this would also deny us access to many camps that are controlled by actors who do not welcome, questions related to recruitment. On the other side, also, the children associated with extremist groups may be seen as security threats in their community, and they are, at risk of being arrested and detained by the government, and in some cases deported if they're not Lebanese. On the social side, there, it's the stigma against the children. It's also the acceptance of the organization might be also affected. We might be perceived as we are collecting, data around, those same groups. That's in addition to the staff safety and all that. So yeah, it's extremely sensitive in Lebanon, and denying us access to those camps where these armed groups are operating, or they are controlling those camps, might also affect, accessing other families who are in need.
Yeah. All right. Yeah, thank you. Thank you very much, Sandra. I think that's a very interesting context. I don't know very well, to be honest. I know Lebanon, but for other protection issues than CAAFAG. And but I can easily imagine the level of sensitivity. So thanks.
Yeah, because legally we are forced to report if a child is associated with armed groups. So we're working closely with UNICEF on this through the MRM. Yeah.
Okay. So when you say legally obliged to report, it's through the MRM, right? Not to the government.
As NGOs to the MRM, yes.
Okay. All
But
right.
in the community, on the community level, if the government knows that we did not report if they know that there is a child that we are aware of and we did not report to the government, we might be also, affected.
All right. Okay. Thank you. All right. I see two hands up. Marie Rivette. Go ahead.
Thank you so much. I will share a quick example on DRC. One of the barrier we had, I think we had a clear protocol in place with the army, for screening during the recruitment process. However, we might see some disconnection between the commitment and people recruiting in the field. Okay, because sometimes we might have some protocol and we are working during the formal recruitment process. However, sometimes it's quite difficult to know exactly what is happening in the field, and even the responsibles at the in the localities don't know exactly what is being discussed, at the higher level. And even though you think you reduce the risk, but when people are going to the field, they are still being targeted, they are still being harassed, you see, and the protocol is not really respected. And I think the same also can be seen with the armed groups, because we do not have a lot of control between what is happening with the person we are discussing and the level of authority they might have with their, with the one really recruiting the children. So I think this kind of all of the risks are quite similar in several contexts, but the disconnection between the commitment and people recruiting exactly the children can be quite tough. And at this moment, it's really difficult to find evidences, because sometimes I think in our sector, they are asking for evidences to say, okay, how many children, where they are, how they have been recruited, and etc. So when you do not have those figures, it can be more difficult, even to design a program. You need to showcase to give the caseload. So I think those are some challenges also that we might want to raise. Over.
Okay. Thank you. Thank you very much. All right. I think there was another hand up. Abigail, would you like also to talk about challenges for needs assessment?
Yes, maybe I was actually going to ask whether someone from Latin America would be able to better explain, but one of the challenges that I know my colleagues in Colombia has expressed is the normalization, if I may suggest, of association with armed groups. In a context like Colombia, where it's almost because armed actors in Latin America and in Colombia specifically has become part of the society, has become part of the daily functioning of the country. They are almost seen as employers, as social supporters, and therefore the access to these groups are almost seen as a viable option for economic and social stability. So I guess in that context, this must be almost the normalization of that process might be a big challenge in to actually initiate even a discussion around CAAFAG in a country like that. But maybe the Colombia or Latin America colleagues have more to say about that. Over.
Yeah, thank you very much, Miguel. Indeed, I'm also in contact with my colleagues from Colombia, Ecuador, and this is, Ecuador is a bit different, but yeah, they are so entrenched into the community that it's extremely difficult to ask any question anyway. They would know, you know, they are part of the community themselves. So, all right. Okay, well, thank you very much for all of your sharing your experience. So in terms of strategies, I can share some of the strategies that I have put in place, some that I have also discussed with some of my colleagues. So basically these tools, like the tools from the CAAFAG task force, I've used them in 10 countries, if I'm not mistaken. Yeah, done about 10 context analysis. Colombia is one, Mozambique, CAR, Burkina Faso. Where else did we do it? Yeah, in many countries. I can get you the list if you're interested. So we have adapted, of course, every time to the context. There are places where it was extremely difficult, other places where it was a bit easier. And so these are some of the strategies that we have put in place. So in some countries, the focus group discussion, for example, is just not an option. So although you have it as a tool, these are for contexts like CAR, for example, DRC, maybe not so much anymore, but it used to be okay. But in the other contexts, the key informant interviews are really the best option, because speaking in public is really uncomfortable on these topics. If it's not too sensitive, it's still interesting to have both, because then you will have different type of information. But key informant interviews is definitely safer. There are contexts where doing key informant interviews with community members is also extremely challenging. And so you may just target NGO staff and community-based organizations, for example. I think we've done that in I forgot which country, but this is maybe Mozambique. This is what the one of the approach that we took there as well. So it was just to talk about people that you know it's safe to talk to, right? So you're not going to expose anyone. This is a private conversation. You know these people are on your side in a way. You know they're not going to denounce you to anyone, and it's also in their interest that these things are known and documented. So identifying those right people. These meetings also can be done remotely, so you can do it over the phone and very discreetly. So you don't even need to go to places which can be extremely unsafe to go to without, you know, all very visible protection. You can also use trusted entry points. So there are places, for example, where you know that a religious leader is someone who has been fighting against child recruitment. This person knows very well the community. They know everything inside out. And this is a good entry point for you to first to interview that person directly about what this person knows about child recruitment, but also it may put you in contact with families who are ready to talk about what happened to them. And the idea is not necessarily to document, you know, which child has been recruited, but more about the dynamics in the community, about who is putting pressure over whom. Is the community leader supportive of child recruitment? Are they, you know, collaborating with the armed group because they want protection? You know, all this understanding of dynamics is very useful when you want to design your project. There is also what I call proxy to talk about CAAFAG. So there are places where, you know, when you talk about a child being recruited by the armed group, it's it's way too sensitive. You can't even say those words out loud. But if you say, how about the children who are wearing camouflage clothes? Everybody knows who you're talking about. Or those children who are wearing gold chains. I know in Colombia, the children seems to have like gold chains that are quite visible, and it's a sign that they are recruited. That can be more or less discreet, you know, like people with tattoos. I know in Mali, there are children with talkie-walkies, and we know these kids are working with the armed group to collect information. So this can be like kind of an indirect way of talking about something that is very sensitive. It may not work everywhere. You know, some people may still feel uncomfortable, but that's also something to look at. So these are some of the ideas. I don't know if you have others, other things to share on mitigation measures to reduce the risk.
Yeah.
Yes, Jan. Oh, you unmute. You muted, sorry.
Sorry about that. Just one quick example in Mozambique, when we were going in to set up an MRM mechanism, monitoring reporting mechanism, we never mentioned or were using the words CAAFAG, and it was really specifically to try and pick up on setting up a working group that were really going to be specific to try and support release and reintegration, particularly on the reintegration side. But we never called it CAAFAG. It was more like child safety working group or child rights monitoring. Even the word monitoring is sensitive, right? But so we're just trying to use euphemisms and trying to avoid CAAFAG language in when engaging with the community authorities, if you will. Over.
Yeah. No, thank you. And actually in the script that you will see in the tools, in the toolkit, you have things like, we want to know the vulnerable children from your community. We want to support children's rights, exactly, this kind of thing. So it's also a way to introduce it in a way that is a bit more gentle. Another way we've done it, I think that was in CAR. So in CAR, the CPOR at the time, it will soon no longer exist, had planned a needs assessment for child protection, something wider. So we were talking about like child marriage and child labor and what else? Unaccompanied separated children. And so CAAFAG was one of them. I mean, CAR is definitely a context where it was less sensitive than in others, but the fact that it was packaged into something bigger, well, first, it's easier to mobilize resources. So it was like, few questions among others. So it's a bit less sensitive. It's kind of wrapped, you know, with other protection issues that people will feel more comfortable talking about. So that was another strategy. Marie, I see your hand up. Is it an old hand or is it a new one?
It's a new one and it's a
It's a new one.
question.
Yes.
Yeah, it's a question. In the list, you mentioned conduct interview with NGO, right? Is it better or can it be biased to conduct those discussions with organization already working with CAAFAG? So, or only working on child protection, okay? When you say NGO here, is it any, NGO working on any field, or is it better to focus on NGOs working in the same same topic on CAAFAG?
Yeah, that's a good question. I think it really depends on the context and then how you feel. I think this is definitely, a bias in a way in your report or in the research that you're conducting. These are people who may have an interest in emphasizing this issue. But this is also a safer way. So, for example, instead of asking community members who, you don't really know who they are, they may then talk to the community leader and then say this NGO is asking these questions, you know, like you don't really know. Whereas going through NGOs, it's a bit safer and it can give you a snapshot of the phenomenon. Is it something really big? They can say, oh yes, we have few cases, is that okay? Or they may say, okay, it's a big issue, we cannot talk about it, but everybody knows about it. Like there are like massive recruitment organized by armed groups in the square, the central square of the village, like we see all these children lined up, you know. So they will give you this information and you know this is a safe entry point. So it's maybe not any NGO. This might be NGO who are already, whether working on the subject or just present, they may work on other protection issues. I think ideally it's still an NGO who works on protection because they understand the risk, they understand the dynamics and why this is important to talk about it. You have also community-based organizations. If there are some that maybe you know already, you have partnered with before, and then they are really at the center of the community. Those women's association, for example, if you want to have information about girls, you need to find different entry points. Quite often, if you ask people about the recruitment of girls, they will tell you there are no girls because they think about the girls with weapons, you know. Can tell you, we did the assessment in northwest Syria. And I said, okay, let's ask the question about the girls. And the team removed all the questions. So every question is split in two. You have a question for boys. So for example, like how are boys recruited into the armed group, who are in the intermediaries, who's putting pressure and so on. And then you have the same question for girls. And they removed all the questions for girls. They said, no, there are no girls here. It's not like northeast Syria where girls are being recruited to fight. And I say, I know it's different, but they are girls. They just play a different role. And I had to fight really hard to keep those questions about girls. And some people did say, oh, no, there are no girls. I don't know about them. And then there are people who say, yes, the girls are recruited to be a wife, to be in union, to be sexually exploited, to do like domestic tasks. So if you don't force it, sometimes it's also challenging. And so using entry points like the Women's Association to identify, to have information about girls is a very good entry point. So there you will not say, are girls recruited by armed groups? You will say, are girls taken for as wife or marriage by the armed group members? And they will say, yes, yes, of course. They offer a dowry, they give money to the family, sometimes it's pressured, it's forced. So you need to find the right entry point. This is what I'm saying. Okay, we are almost at time. A few minutes left. Is there anyone else who would like to add an experience, a strategy? So
Maybe I have another point.
Yes, please.
It's how to manage data and confidentiality around the process. Okay. I haven't seen that much into the question or what you presented.
Yes.
However, sometimes in terms of, how can I say, can we ask question for a purpose, but not telling the person why we are asking the question? You see, it's kind of ethical problem, no?
Yeah, sorry, go ahead.
And how to manage confidentiality and those kind of finding the right balance between what to say in the report, what to avoid, so any kind of guidance on that.
Right. So in the toolkit, you will see the script. The script explains, the confidentiality, at least the way, Plan and other organizations use it. So we don't take the name of the people who ask question. It's actually, I always tell the data collectors, we don't want the names, because as soon as you put a name, you put this person at risk. So we don't want that information. Like the broader, is it a teacher? Is it, okay, that's it. We don't need anything else. That's the first thing. I think the second thing is we need to collect data ethically. So you cannot, to me at least, ask questions to people without telling them the purpose. You know, that's not ethical. People need to know why you're collecting this data, what it's been used for. Is it going to be shared in a report? Is the report public? All of this needs to be included into the script. The script is quite long, but it's really to explain everything to the person. The person has the right to stop answering question at any time without any justification. They have the right to skip, to leave, to, you know, it's very important. The more you reassure the person before, in my experience, the more they're then confident to open up. But if you're like kind of, you know, vague and saying, yes, you know, I'm just asking, and without really explaining, like they will not feel comfortable. So be upfront and say, we're collecting this data for this purpose. We try to understand what is the dynamic, the issues. We want to protect children. We need your help. To be very, very clear. And then in the report, your report doesn't need to be public. That's the first thing. It can be just for internal purposes. If it's public, then of course you need to be careful, mainly with the government. It can be also an interagency report, and this is what we've done. So all the context analysis I've done, the 10 I've done around the world with these tools, I've always been done interagency. So it's less pressure. It's not like you, NGO XYZ, exposing yourself, you know, upfront. It's like a collective. It's the CPOR. It's all together. So it's harder for the government or for an armed group to target people individually because it's a collective. Also be careful to not mention any names. Even like in the acknowledgement, don't mention anyone. In all the report, I've done quite a lot of report, I never mention people's names because it's, yeah, you may expose them. So these are some of the mitigation measures. All right, who else? Then it was Jessica Jackson, I think, next.
Hello, hi Sandra.
Hi.
So I have a quick question around data collection, especially for children, for lack of a better term, who've aged through the system, who were recruited when they were or associated with armed group to armed forces when they were younger, below the age of 18. So how do we consider them in this process and also during our program design phases?
Yes, that's a bit of a different question. I think in terms of data collection, to me, I still collect data with children who are older. Also because they have a bit more maturity and they're more able to reflect on what they've been through. So they know they were recruited as a child, they've gone through the whole process, and now they're a bit older. I find that their level of maturity is higher and they're able more to analyze things and to take a bit of distance and understand what happened to them than younger children. So I would definitely include them. Then you say former CAAFAG, you know, they're no longer children. They used to be CAAFAG, young adults. I'm just finishing now a report and I've interviewed those children who are now, so I think I call them young adults who former CAAFAG, something like that. In terms of programming, then it's up to you and your organization. You know, if your organization is open to work with youth, definitely go for it. They need support, and a lot of time when they reach 18, this is when they lose all the support. But if your organization is willing to work with older youth up to 25, for example, that's really beneficial for them. We are at times. I see there are 2 more hand up. So For those who can stay, you're welcome to stay. For the others, feel free to drop. So we have Anos and then Abu Bakr, and then I will close. Anos, go ahead.
Yeah, thank you. Yeah, it's me, Anas, from Rohingya refugee camp, Bazar, Bangladesh. Actually, I'm working as a child protection volunteer with a local organization. So, yeah, if we in refugee contest about the CAAFAG, yeah, there is a reason behind it because of the poverty and unemployment. Most of the people are trapped in the false promise by the targeter, by the CAAFAG targeter. So it's all happening because of the limited resources and and also inadequate of the lack of education or literacy about the knowledge. To protect this, I think it's the best way to about the awareness campaign and other like that. So what is the solution to be protect about the children and remove the poverty or unemployment? Yeah, thank you.
Yes, thank you, Anos. I will be able to answer that big question now in a few minutes. But what I would say is that through the needs assessment, you need to document very clearly the dynamics, because I know Bangladesh a little bit in this context. There are lots of pressures, there are threats. It's economic, but it's also like there are local dynamics within the camps. So that you need to understand well to then be able to design your response to address those risk factors. This is really the best way. Like the awareness raising campaign, this kind of thing, it's really marginal. You need to address the risk factors, otherwise your prevention program won't work. Sorry, I'm rushing a little bit. And then Abu Bakr.
Okay. Thank you so much, Sandra. This is Abubakar Sadiq Kau from Nigeria, northeastern Nigeria. So my question is that I understand that the need assessment for CAAFAG is a very sensitive area, and in terms of case management, so need assessment is very key in terms of supporting those children with protection concerns. So how can we have a specific CAAFAG needs assessment integrated into the CPIMS case management, so that we may have a very clear documentation in the CPIMS Primero in terms of the CAG. I understand that early this year we have some specific form in CPIMS related to the CAF and CGTF, but basically this recently I checked the dashboard, it's still not there. So I don't know whether how we can come up with very some questions or maybe some the need assessment that we can incorporate into the CPIM. Thank you, and over.
So here is a needs assessment for you. You talk about the case management process, right? So that's just to make sure. Okay, all right.
Yes.
So that's a bit different, but yes. So I won't have time to go into too much details, but there are global CAAFAG, there are global case management tools. And then within this case management tool, so we had a discussion, we decided not to have a separate tool for CAAFAG. So this was agreed, there was a lot of back and forth, but we landed on that decision. Now I have designed a tool, which is a checklist to help you look for specific things within all the section of the needs assessment. So you have a section on safety, on family, on work, right? And so I have like basically a list of questions and things you need to look at for all of these sections. I'm also sharing with you that I'm currently working on a case management module for CAAFAG. So this should be ready early next year. And to basically know, to look for what is specific about CAAFAG during the case management process. So this is, I'm sharing the news with you a bit in advance, but hopefully next year we will have this new tool to share. All right, I see there are still questions. Unfortunately, we don't have time to answer it now, but we have the community of practice. So I will take the questions here that we didn't have time to answer. I see Pedro has dropped the link. So we have on the committee of practice a thread specifically on this topic. So we will continue talking. I invite you to click on this link and then join us there to continue asking your questions, and I can give all the answers. All right, thank you for everyone.
Sorry, just before you go, the link is not working for some reason.
It's not? Oh,
Let me just try to send it again just so people can get it before we close the meeting.
okay. Yes, thank you, Pedro.
There we go. The new link should be, I just dropped it in the chat.
Okay, and that one works?
Yes, it's working. Thank you.
Okay, all right. Well, thank you everyone for your active participation. That was a pleasure to facilitate this clinic. We're gonna have more on different topic. I think we still need to think about the next one, but probably program design will be one of the next topic. I hope this format is also useful for you and a bit more engaging than the usual webinar. So thank you. Thank you. I wish you a good rest of your day. And then I see you soon on the committee of practice.
Thanks a lot, Sandra. Amazing work. Really, really
Thank
appreciate
you.
your guidance. Awesome. Thanks, everyone.
Thanks.
Bye-bye.
Yeah.